In the tapestry of life, where every thread holds a story, America in black and white emerges as a haven for the voices echoing through the heart of our communities. In this podcast, we wade through the rivers of our collective experiences, celebrating the vibrant hues of change brought forth by the whispers of hope and the roars of action. It's more than just a conversation. It's a journey into the heart of our society, illuminated by the light of those daring to dream and do. Join us, and let your voice be the melody that guides us toward a dawn where every color finds its place in the masterpiece of our shared destiny. Together, let's paint a future brimming with the positives that dwell in our minds and the actions that shape our world.
Good evening, ladies and gentlemen, and welcome to another episode of America in Black and White, where we discuss the issues that plague the underserved and marginalized communities and how we can best represent, build, expand, motivate, and excite the people of those communities. Tonight, we have a very special guest. We have Mr. Amari Johnson. Amari Johnson is a dedicated healthcare leader and family man with a strong passion for mentoring and community service. He thrives to become a healthcare CEO and specializes in process improvement, consultancy, focusing, and optimizing operations and driving meaningful change in healthcare systems. Amari has earned a bachelor's in business administration and a master's in healthcare administration from Southern New Hampshire University and is currently completing his doctorate in healthcare administration at Walden University. He is happily married to Brianna Johnson, and together they have two children, Aiden, 6, and Lauren, 4, who inspire him daily to lead by example. Amari serves as the district chaplain for the Bartow County Boy Scouts Association, where he mentors young men and fosters leadership in his community. With his strong foundation in healthcare administration, a commitment to process improvement, and a heart for service, Amari is dedicated to making a lasting impact both professionally and professionally. Amari's long-term goals include becoming a healthcare CEO, expanding his expertise in process improvements consultancy, and empowering communities by mentoring the next generation of leaders. He also aims to inspire excellence through sustainable business ventures, community service, and impactful healthcare innovation. Ladies and gentlemen, I introduce you all to Mr. Amari C. Johnson. Welcome to the show, sir.
Hey there, how's everybody doing? I want to first off, Charles, say thank you for having me on. It's definitely a privilege, and I'm just happy to be here with you and just be able to share the same space.
Yes, sir. Also, is there anything you'd like to add to your bio before we get into the show?
Charles, I think you covered everything there. Let's see. Other than kind of the work that we do here in the community with the Boy Scouts and just here in Bartow County is pretty much where I'm based at. So we do a lot with the county. We do a lot with Atrium. So I just love being involved. If you're here locally anywhere in the Rome or Bartow County area, you'll probably see us partaking in any kind of parade that we're having in the community, or probably just out eating with the family. So I'm just as about as regular as anybody else, and I just really just enjoy getting out, having a great time, and just being able to network and meet new folks, especially young people like myself who are just having interest in anything.
Well, I definitely appreciate that, and I'm glad that we've got you as a guest because, you know, in these days and times, I mean, talking healthcare means a whole lot and is very valuable for people in the underserved and marginalized communities. We're going to jump right into, the first topic that we like to talk about is healthcare access. So can you tell us what inspired you to pursue a career in healthcare administration?
Absolutely. So, Charles, growing up in just a thriving household of it was me and my father. I also grew up in my grandmother's household. You know, although I lived with my father, my grandmother, a mother of 9 kids, her house was always full. So that was my second home. Just like anybody else's family, we had kind of like just a good amount of members who just really had health issues. Being able to want to help, want to have an impact in that, it didn't really hit me until I got a little older. I just kind of realized my father, once he was diagnosed with cancer, it didn't hit me that, I wish it was something I can do. At this time, I was already about 27, right? And I was like, it's not much I can do from the professional standpoint of where I was. I was a business major. I didn't go to school for business administration during that time, but during that time, it made me realize I want to go ahead and shift education to where I can have an impact on those who are impacted by their health and those who are looking for answers that we quite don't have yet. And I feel like we start and we end with health. So healthcare is where I wanted to be at that time.
Oh, wow. I'm sorry, to hear about that situation, because I do know, especially when you talk about cancer, that could be very devastating, because my mom just passed last June, with cancer. And, that's a bit much. How do you ensure equitable access to healthcare services in your role?
Absolutely. It starts by communication. We are all entitled to the same access of healthcare. However, are we all entitled to that same information? Are we accessible to being able to hear the same thing that we're able to hear in other communities? So, healthcare professionals and the healthcare organizations are trying to ensure that they're not only in the community, but they are also connected with their community. It takes a lot more of that to be able to make sure we spread awareness to being able to take care of yourself. Instead of going to the ER, we want to make sure we let folks know, hey, let's go ahead and set up primary care appointments. Let's go ahead and get to know your doctors. Let's go ahead and start being more aware of how to prevent, these care gaps that arise in not only just Black communities, but with all communities.
Mm-hmm. So can you tell me, so as an administrator, and we talk about this access to healthcare, is this before or after people have insurance, or how exactly does that access work?
Absolutely. So for those who lack health insurance, there are plenty of healthcare organizations out there who are not only here to advocate for you, but also here to show you the way of, hey, here's how you go about getting affordable healthcare. Whether it's going through Marketplace or maybe even potentially going through your employer, there are several avenues of just being able to be educated on how to go ahead and make sure you have access to just the best quality care. I think it all starts out by making sure, for one, you are insured. And at the end of the day, if not, we want to be able to show you different avenues you can probably take to go ahead and make sure you're paying less out of pocket. A lot of times we're all familiar with those prescription savings cards that come in our mail. Most of those are pushed by community advocates and companies who want to make sure that you, every time you go to your local pharmacy, that you're not spending a lot of money on those prescription drugs. So our goal is to make sure not only do we educate you all and those out there who are unaware of how to go ahead and get affordable health insurance. Not only do we educate them on that, but we also make sure that we do a lot of different local gatherings out in the community where you all can come to not just our organization, but other organizations, and sign up for those kind of care plans. So it's hard to be that action step, but we make sure that at the end of the day, we can be in your neighborhood and make it as easy as possible for you.
So tell us this. When let's say, like, we know, as you mentioned, people can get insurance like via their job plans, or they can go out through the healthcare exchange. Are there other places that people can actually go and search to find healthcare insurance?
Absolutely. So if you don't feel comfortable for what you see on the Marketplace, or let's just say your employer rate is a little bit too much coming out your check, you have full access to to get on your browser and look at healthcare plans that best fit you. A lot of times it will point you towards the Marketplace, because I think I advocate for it strong. That's where you go to be able to whether you take a survey or whether you put in different filters that best match your situation, they will help you find something that's not only affordable, but fits your family and you pretty well.
Okay. So what are the biggest challenges you face in improving healthcare access for underserved communities?
I love that question. I believe in order for us to have the most impact, the challenge starts with trying to, not trying, but to be in the right place at the right time. And as we all know, there can be a huge time crunch in our schedules, whether it's just because we're going to work and dealing with our kids, or just, maybe we just don't have access to get to where we want to get to have that impact. Me and my wife, before we came over to Cartersville, Georgia, we lived in Atlanta. Atlanta has a very high population rate of uninsured individuals. But what I also seen was that there were plenty of people out there advocating why you should go ahead and make sure you're covered, and also ensuring that you had a way to sign up for those coverages. The biggest gap that we face, and what makes our job a little harder to making sure we can make that connection with the community, is that a lot of times we're not where we need to be. And the biggest problem is because, for one, we have to market how we're going to get there. We're going to market where we are going to be. We got to make sure that we're, most times you hear from a lot of different companies and organizations during community gatherings, whether it may be a parade, a block party, maybe you're meeting at your local football games or what have you. We try to find the best way to meet the community where they are. That's our job. It's to make it easy for them to come to us. But the biggest challenge is sometimes being able to make it to every event, and also being able to just be in the area where you can go ahead and push that information out.
So let me ask you, when you've done your work via community, and we just think about healthcare in general, when we and just staying here where we're talking about the underserved communities, how has that looked in the past few years as to not only just the coverage, but the health of the individuals in those communities? How has that looked over the past 5 years?
I'll tell you, I believe we're getting a step closer to where we need to be every year. What we do, we make sure our providers and our medical team, whether it's an MA or front desk, reception, etc., local primary care, urgent care, and even emergency room, help you realize where you need to get to and how you can better take care of yourself. We educate our medical team on how to better educate our community on how to take better care of themselves. Doing that, I can tell you that we've unfortunately don't have the stats in front of me, but I can tell you before I came in today, looking at the quality side of things when it comes to just my profession itself, working with Atrium, we see that our numbers between our patients grow when it comes to more people getting checked out for maybe cervical cancer screenings, breast cancer screenings, and what have you. We ensure that we educate them when they're coming in for just, maybe somebody came in for an ear infection. And hey, while you're here, we're in your chart, and we see that, it's probably a good time to schedule a mammogram. We would advocate that you go ahead and do that, and we can get you in during this appointment. How does that sound? It's not always up to your patient to say, hey, when can I come in for a mammogram? When can I come in for a colonoscopy? We have to also remember that in the healthcare industry, we are advocates for you. It's our job to let you know when you can come in for your nearest service. So doing that, we've seen numbers improve. We've seen numbers grow upward. We can do a lot better, and we're aiming to do a lot better. But it all starts with us. And it also starts with us making sure that we are involved at a community level.
Wow, well, that's definitely a good thing to hear. Can you share a success story where you significantly improved healthcare access for a community?
Well, I'll tell you, so I'm very new in my current role with Atrium, so I haven't been able to kind of put my boots in there and get to work just yet. But with the Georgia Guard, I have had a privilege of working under a what we would call a medical NCO. Our medical NCO is responsible for ensuring that everybody in the Georgia Guard is lined up and ready to receive their care when it comes to when we do our annual training. During that time frame, we also lead into SRP. It's a soldier readiness program to ensure that we have all of our shots, where our dental records are up to date. So what I've done to pretty much help us do what I've done to ensure that we can fulfill those care gaps is to look out. I've reached out to soldiers. And there was a point in time where we had a lot of outdated records. In order to update those records, you got to get in contact with soldiers. And I think around this time, I've had to reach out to at least about maybe 50 soldiers within my first week before going into SRP. We had a huge success. We went in there and we made sure before we not only did our annual training that we were ready and just ready to go ahead and smash it, but we also ensured that we educated those soldiers about why it's important to get these care needs filled. And we also educated them on how they can go ahead and not only do it on the military side, but when you go back home, here's how you can keep up with your chart. Educated them about my chart, which a lot of people are aware of. And we're trying to make sure that we educate not only our civilians, but our soldiers on how to be better care advocates for themselves and their families. So that was a pretty big success.
Okay. How do you address the social determinants of health in your work?
I would say currently right now we do, we're all numbers. So I work with a great team of individuals. And from day in and day out, they're all in meetings. We're all in meetings. And our care team is interacting with us day in and day out to figure out how we can better improve healthcare and those social determinants, as you mentioned, of our patients. What we do is we ensure that we get a chance to reach out personally, reach out to the patients, and we educate them. Now, you'll hear me say back to back, education is what it takes to improve care. So I'm always going to say we educate. I think we cannot have an impact in healthcare for our community if we don't let them know what's the risk. You'll hear a lot of times at Atrium, we talk about preventative care. I think that's our bread and butter. In order to prevent, potentially missing cancer, not getting Cologuards, we have to educate not only our team, but we have to educate our patients. So to fill these care gaps, we reach out to our team, we reach out to our patients, and we let them know the best route to go. And we also talk to them and let them educate us about a little bit of their family history. And we take that very seriously as far as how we can prevent many care gaps that they have.
So as we're, like in this early part of the interview, can you just tell our audience what is the most important thing, or what are some of the important things of knowing why they need to have access to healthcare?
You need to have access to healthcare, more so, especially if you have a family. It's important in general because you have to take care of yourself. For example, it's me, myself, my wife, and we have 2 children. If I'm not taking care of myself, I can't take care of my family. And so I think that's the priority for most of our communities. Whether you're a mother, a father, a grandparent, what have you, we gotta carry on for our families. Not only that, but a lot of times we're doing a lot of great things in our communities. And in order to continue to push a good social change, we got to take care of ourselves. So a lot of times we get a little selfish. Sometimes we come home and we go, oh man, I got an appointment coming up at 2:30. I don't know if I feel like going. I just cancel it. And a month down the line, something happens. Maybe there was a stroke you could have avoided. Maybe there was some eating habits you could have, cut back on to cut down on, hypertension. If we're not seeing about ourselves, then we're going to cause a bigger problem down the line. And, unfortunately, sometimes that can be, death. We have families. And at the end of the day, we have impact in many people's lives and in our community. So we got to just be more aware of what's going on, and we got to ensure that we're taking care of ourselves. So I'm going to always advocate that at the end of the day, it's not about you. My old boss used to say, it's not I and me, it's about us and we. We got to remember that. It's not just a you thing. You have to see about yourself. You got to get taken care of.
So what strategies do you use to increase awareness and utilization of healthcare services?
Oh, social media. I love getting on LinkedIn, and I love sharing information on LinkedIn, Facebook, Twitter. You name it, we're going to find our way to go ahead and advocate and push out. As time goes on, we have to grow with society. Everybody is facing phone. Even right now, I have my phone right here. We don't ever really keep our phone nowhere further than 5 feet from us. So that's the best way to advocate to people. Also, we do a good job at promoting using billboards. I think we're doing away with a lot of paper ads, just in general. A lot of times, if you want somebody to know something, you're going to put it in their face. You're going to do it over the phone. So social media is a great way to go ahead and get that out.
Okay. And how do you collaborate with other organizations to enhance healthcare access?
I love that. Collaborating it's in what we all do. And so a lot of times we can collaborate, whether it's with sport organizations. It's all about being able to give and receive, if you will. We collaborate by ensuring that first off, we have a number one, priority and goal, and that's to bring our community together. Mm-hmm. So it brings us back to the topic of community. So we use, whether it's our local baseball team or local high school football team, the best way to go ahead and pair up is to ensure, for one, we're here for our community. Help us reach out to your audience so they can take care of themselves. Let's go ahead and drop off a few pieces of knowledge of how to make sure that you're up and well and ready to take on the day. So when it comes to partnering up with these community organizations, we ensure that, number one, we have the same goal, and that's to make sure that our community is well and safe.
So what role does technology play in improving healthcare access?
A huge one. Very huge. I think even now we face a challenge with AI being here, artificial intelligence. It has posed a great benefit, but also a few challenges. It's hard to know what's real and what's fake now. But when it comes to electronics, it's the way that we're able to keep up with the changing span of healthcare. EHR, you're going to hear that a lot, right? And that's the electronic health record. You're going to be able to keep up with your patient's data just by ensuring that you're using systems like Epic. And this electronic, this system, this software, it has a whole world of your patient inside of it. It is a preventative care, so thanks to programs like these EHR systems allow us to be able to not only fill a care gap, but kind of see something before it hits. It allow us to track, patterns of maybe high blood pressure for sure, and maybe some poor habits, depending on what the patient may be sharing. It is preventative care. It is the preventative care tool kit that we all use.
Okay. So how do you measure the effectiveness of your initiatives to improve healthcare access?
Well, we measure a lot of our effectiveness based off of metrics. So depending on how we're reaching out to our patients, or how we're reaching out to different healthcare facilities, we measure our success by looking at the growth of progress that we are trying to make, or that we are making. I'm sorry, that's a better way to put it, not trying to make. So a lot of times, we have where you'll probably hear HEDIS measures, right? Or you'll probably hear guidelines that are put out from CMS, and that's the Center of Medicare, Medicaid.
Mhm.
So a lot of times, in order to see that we're doing a pretty good job, we have to actually look at numbers of improvement. So
Mhm.
whether you're reaching out to a certain amount of patients in January, and we want to see if we've improved here in February, what we're going to do is not only push out that, hey, this is the action that must happen, but we measure our success by using metrics.
Okay. So tell us, what are your future goals for improving healthcare access in your community?
I want to see more younger people, and I'm not just talking younger people in the community. I want to see more young healthcare leaders.
Mhm.
It 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 doesn't end with senior leaders. You know, I think in order to get that experience level um, that our senior leaders in healthcare right now have, it's time to put a little trust in younger leadership, and I think we got to start doing that a little early. I think the younger generation is more in touch with how to connect now. So I'm sorry, we got a little lag here, so it may be my computer connection, but I just noticed that a little bit. But that's what it's going to take. It's going to take putting more younger people in the seat to have that impact and to make that impact. We have to trust uh, that that's what it's going to take to make the change that we want to see.
Okay. So now we're going to transition over to preventive care. You kind of like hit on that a little bit, a few questions ago. But tell us, why is preventive care important in healthcare administration?
Preventive care is we can't avoid going to the hospital. Sometimes you just can't stop it. However, understanding how to prevent certain things such as hypertension, um, such as the low cholesterol, you have to be aware, and that's what the primary care physician is going to do for you. Finding a local physician in your area or a doctor's office, and just kind of being educated on your body is what it's going to take for you to make that change. So it's just you got to be aware, and so preventative care is awareness. In order to go ahead and getting in understanding how you can maybe overcome a certain situation. For example, my wife had diabetes. She was pre-diabetic and didn't know it until she went to our new healthcare provider, and uh, it was another visit that she went to, and they said, "Hey, it's looking like you're on the scope of full diabetes." And it's like, well, it could have been prevented. Have I came to these appointments a little bit more frequently? More so, it could have been prevented if we had a better care team who knew how to advocate my needs and what I could have changed. So
Right.
preventative care is all about, first off, let's be informative. But
Mhm.
to get that information, you got to be willing to take yourself and put yourself in a position to hear that information.
So, how do you promote preventive care among patients and the community?
I love that question. So to me, it's two ways to do that. One has to be voluntary, which is I'm going to be in your community. I'm going to talk to you, and then you just have to want to take that knowledge.
Mhm.
The other part of that is that we got to be a little forceful. As the healthcare organization that knows what you need to do, we have your chart. If you have not been to a primary care doctor, however, you've been to urgent care, and they say, yeah, this patient looks like this is somebody I would like to go and see a primary care doctor a bit more commonly. I would advocate that those care teams need to go ahead and schedule you that appointment by making sure they, for one, get in contact with you and say, "Hey, I'm going to refer you to a primary care doctor. Let's see how you're doing. Let's see how you're holding up." Sometimes we need that reminder, but it's a two-way street. So, for those who want to hear that information, we want to reach out to you in your community. For those who are not quite thinking about it, we want to get somebody on your phone line letting you know, "Hey, it's time to take care of us. Let's go."
Mhm. Um, what are some common barriers to preventive care, and how do you address them?
Well, We got a few different barriers. The main one is the one that we can't prevent, which is if it runs your genes. Um, I was just actually kind of writing about this on the assignment, but after years of doing the wrong things from generation to generation, whether it's not going to primary care appointments and taking care of yourself, you're going to develop a gene pool that is going to impact your children. And it's nothing they can do about having hypertension issues. There's nothing they can do about having certain cancer cells, biting at their body. So a lot of times we have to remember that we have to educate our team and our family and our teammates on how to do a better job at, first off, going to see about themselves. And secondly, we have to ensure that we remember we got little ones that we got to take care of, right? Our children are impacted by what we do. My uncle, high blood pressure at some point leads off into me. So we have to, if we don't want to kind of injure, as I would say, the health of the up and coming generation that we're bringing into the world, we got to take care of ourselves. In addition to that, we also have to make sure we're more involved in taking care of ourselves. That's where it starts with. You just have to make sure you put yourself in a position to where you are looking out for you and you're looking out for your children. And so to prevent yourself from being in a situation where later on down the line you're looking at a hypertension issue that you just really can't do much with. You have to, for one, get educated by a primary care physician and just get to learn a little bit more about yourself and those genes in your family and how you can go ahead and make that, if not irreversible, how you can at least make it better for your family and yourself.
So can you share an example of a successful preventive care program you implemented?
So right now we're doing a A3. And if you don't know, A3 is a lean tool. It is, and it's a current project that we're doing now, but it's a process improvement tool that we use to, for one, identify a problem that we're currently having in our process and how we can use changes in this process of what we can eliminate, what we can add in order to get ourselves where we want to be. So we're doing an A3 in using macros and smart phrases to pretty much speed up the care given in our care facilities. So macros, for those who are unaware in the EPIC system, is pretty much a template that allows you to complete a Medicare wellness screening or a PHA screening, which is a depression screening. We try to find a way to help you push these screenings out quicker. That way you can go ahead and get your patient over to their physician, get them seen a little quicker. And it saves more time and allows us to see more patients quicker. So if we're not spending 20 minutes filling out a survey, that's a good day.
Okay. So how do you educate patients about the benefits of preventive care?
Well, for one, we do it during our appointments. We do it during our appointments. I know you've probably been to an appointment where you've received a pamphlet about how to manage certain care gaps that you might have had. It is the healthcare industry way of letting you know not only are you aware of where you might have fell short at in certain care areas, but how to make sure you improve it and how to make sure you're continuing to stay up to date with it. So we ensure that we inform our patients verbally, and we also make sure we're sending them home with information that to avoid going into a negative decline.
Okay. So what role do healthcare providers play in promoting preventive care?
They play every role. It is our job, no matter if you are the front desk receptionist, all the way up to the CEO. Our job is to ensure, and a lot of people say, well, if you prevent care, you probably have a little less patients coming in the door. And what does that do for you? But at the end of the day, preventative care that is successful means that you have more trust in your physician, in your care team, and you're coming back. We got to address the fact that we're losing a lot of people's trust, with the COVID situations that's been going on, and we've lost a lot of trust in the healthcare field, and it's not necessarily anybody in our field fault. Maybe we're losing trust because some people are just sick of being vaccinated and still at the end of the day probably getting sick. We have to find a way to educate our communities as we're learning to educate ourselves and our teammates on what that's all about. So we're still learning, but we have to gain the trust. And to gain your trust, we have to ensure, for one, we're in the fight with you, and we are transparent with you, and we're right there every step of the way. So transparency is a huge thing. I believe we need to account for when it comes to ensuring that we build trust in the healthcare industry.
So how do you ensure that preventive care services are accessible and affordable?
I like that. Speaking from our organizational standpoint at Atrium, we have a charter bus that goes around our community and does mammograms. So it's just great able to, if you can't get out and come to us, we're saying we're going to come to you and we're going to help you receive this care. We have also a dental bus that goes around, and although it's not with our company, there are companies out there that make sure that they get out there and that they come to you, whether it's at your job location, whether it's at your local community center. They're trying to find ways to get to you to ensure that you're checking in on yourself, that you're just tracking what's going on, that you're able to see them out in your community. It starts there, it ends there. It starts with our community and it ends with our community.
Okay. So what are the most effective preventive care strategies you've seen in practice?
So I've seen a little bit of this last week. I was working with a medical assistant, and we do a lot of shadowing. And she had the opportunity to go in, speak to a patient, and she caught something on a patient's chart and let her know, hey, I think it'd be a great time for you to probably schedule this type of appointment, and let's go ahead and also get you scheduled for this type of appointment. Whether it was a cervical cancer screening, whether it was, hey, let's get you in and let's try to get another blood pressure check for your next upcoming appointment. Our medical team ensures that our patients are not only just family members, and they're that they know that they're with someone and they're in the care of people who really care and really appreciate them. You feel the love at our company. You really do feel it. And so I had an opportunity of working with just a wonderful, outstanding care team, and they really do go above and beyond. I mean, if we have clinicians who knows their patient's chart front to back, and they don't have to open up the health record. They know their names. They know about the husband or the wife who might have passed a couple of years ago. They know about graduation dates. They know it all. And they know how to approach each and every patient with just care and love. And so I think that had a huge impact on me. And being new into healthcare, I got to tell you, that right there definitely changed a little bit of what my intake was of healthcare. And that was that it's an industry that we're here to help, but at the end of the day, we have a job, and it's all about our job. Hospitals are so clean, so sterile, even urgent care, even primary care, of course, because they have to be, but it just feels like when you're going in there to kind of get it over with. But to that care team, they're going to try to make you as comfortable as possible. From ripping off that sheet of paper that goes over that bed that you're going to lay on, they're going to ensure that they're having great conversations with you. They're going to check in and see, how's the baby doing? How you feeling? Are there any concerns? And when they're asking those questions, they mean it. They want to know. So I worked with a wonderful team last week, and it's really just it's more than a mindset. It's just a company. It's the heart. It's the core of who we are.
Well, I'll tell you this. That definitely, when it seems like, especially in healthcare, where you know your patients' really, really well. To that point, it's almost like family. And so that, those are very intimate moments. I think that mean a lot to a lot of patients. And that is how you create the loyalty and the trust, when it comes to healthcare.
That's absolutely right. We got a great team, and being there, I had a chance to kind of also follow around our whole team. So from working with the practice manager to working with the front desk, you felt it. You really did feel it. They knew patient's name without even opening up the medical chart or putting in those. They knew who they were talking to. And so, like you said, it really is a family thing. I don't know if all patients get to experience that or maybe even notice that it's happening, because some patients are like, hey, I'm here to get it over with. Stick me. I'm here to get it over with. Let's go. At the end of the day, you're cranky patients and you're having fun with them. The sweet ones that you can, just talk to. And before you know it, you'll be in a room talking to a patient for about 20 minutes. And haven't probably gotten half of what you needed to get done because y'all are just having such a great time. And so it's just, I love to see it when I do see it.
So how do you stay updated on the latest trends and research in preventive care?
Well, we got a team especially just lined up for that. I'll tell you, if you would have asked me the question about a few years ago, what do I think healthcare composed of? I would have told you it's the hospital, you got your clinical staff, and then you got administration. I would have told you that administration was just your CEO, maybe a department manager, and you probably had two departments, billing, and you probably had marketing, and it's really, Charles, to break down healthcare to you, they got an extraction team that extracts, bad charts and make sure that they're reaching out to the patients to ensure, hey, look, you got some care gaps in here we need to fill up. We literally have a team that is looking for patients who needs to get up and go see a primary care physician and see about themselves. We have a marketing team that gets out there and they promote services to kind of bring us to the question of our marketing team is pushing out each and every day. Hey, come on, let's go ahead and push out some flyers. Let's go ahead and let's get to those schools. Let's get on campus. Let's go to the work site, the job site, and let's let them know, hey, here goes the flyer. Come and see us. You don't have care, don't worry. Here's one avenue you can explore. Just come get seen about. We had a patient, and it happens often, but we had a patient who had a tab, that she didn't pay from her last visit and was getting ready to pay it. And they said, well, it's no rush. Just come get seen about, and we'll have. Sorry, I hit that mic. But without paying for the service, she was able to come back and she realized, it's not all about the money. You guys aren't rushing me to pay this tab right now. No, come get seen about. That's what you're here for. That's what we care about, and we'll handle it later. So just having that is beautiful. But our marketing team does a really good job at ensuring that we're pushing out ways that those who are uninsured to be able to come out and just and feel that it's not that you don't have to be under an insurance care or have to be under any kind of insurance and in order to come see us. There are ways that you can pay your tab. There are ways that you can pay some now, pay some a little later. So there are definitely ways, and we have plenty of people who at our primary care centers and urgent care and all who can advocate with you about routes to get that done.
So what are your long-term goals for improving preventive care in your organization?
Well, long-term, we want to make sure that we have every single individual up from our janitors to our marketing team or, whoever's working in any organization that I'm a part of. I think one team, one sound. So we want to make sure that we're educating our teammates on how to get out there and educate others on how to take care of that primary care. We're all advocates. We are all advocates. That's the best way to put it. And so we have to go out there and let people know the big mission behind making sure that you are going and getting that preventative care, and let them know that at the end of the day, it impacts not only your family, but it impacts your community. You know, you may not think of it now, but if one of us were not to wake up tomorrow, a whole lot of things shift. A whole lot of things shift, and those shifts are the most painful, just life altering, rupturing experiences you can never imagine. And if we can go a day longer without that, we really do the community, our families, a whole lot of good.
Let's transition over to the regular doctor visits. And if you can tell our audience, why are regular doctor visits important for maintaining good health?
Well, it's kind of all in there. So if you're going to a primary care appointment regularly, you get to be updated with your health. You know just as much as the doctor know. You don't get no surprises. If you go every day, you know what's. I'm sorry, not every day, but if you go frequently, you know how to make sure that you're taken care of. So it's all
Right.
about being in the know. Things change. They have it now to where you have these ways to track your A1C in real time. I mean, I've seen devices. I'm talking tiny. You put them right here, or wherever you want to put it, and you go out to Cracker Barrel, McDonald's, or whatever, and you have you a little bit too much sugar. That thing will get on your phone and it'll beep, and you're like, oh man, I better slow down. That's the part. I better slow down. And now it's because it's knowing is the battle in healthcare. It's the battle. So getting out there and making sure is how you prevent these things from hurting you, harming you, and putting you in any kind of prediction that you don't want to be in.
Tell us, how do you encourage patients to schedule and attend regular doctor visits?
You have to, in healthcare, we are working on ways to make sure that it's quick. I think the quickness is the part that the patient wants to know. A lot of times, if I'm not going to a doctor appointment, it's probably because I'm at work. And do I think my boss would mind if I go to an appointment that's under 30 minutes and I can get back to the office real quick? She wouldn't mind at all. If we can go ahead and kind of fit healthcare in the quickest way into a patient's schedule, and let them know that, I think we got a lot more people willing to do it. And that's where we are right now. I've seen appointments, 10, 15 minutes long. Now, that's relatively quick. And these are not urgent care appointments. These are your primary care appointments. This is the appointment that you've probably been waiting for, since last month, since maybe 3-4 months of waiting. But it only took 10 to 15 minutes and you're out the door. You know what you need to know and you're out. So if we can advocate to our patients and let them know, hey, come to get seen about is a quick process. It's self-assuring, and you go on about your day, you know how to move forward. But I think it all has to do with speed. We want our information now. And so the same thing with care. We want our care now. You go to a restaurant, you want your food now. If we're quick, we're able to ensure people that, hey, this is what you want. And at the end of the day, I think a lot more people are willing to come up to those primary care appointments because they'll be relatively quick.
So what are some common reasons patients avoid regular doctor's visits, and how do you address them?
Sometimes we don't want to hear that bad news. We don't want to quite figure out that we've been eating a little too much fried foods. We don't want to figure out that we've had a little too many sweets. A lot of times, if you don't know, it don't hurt. But the bad thing about that is when it hit you and you could have avoided it. A lot of times, that's what it is. A lot of patients don't go to primary care. A lot of people don't go to urgent care because they fear knowing what's going on.
So how do you ensure that patients receive comprehensive care during their visit?
We do our surveys. There are surveys that our patients get every day. I don't care what care facility you are, you should be doing a survey. I don't care if it's urgent care, primary care, even the ER. You should get a survey. That survey lets us know what we're doing right or let us know what we're doing wrong. And it matters. those we have payers. These insurances pay our bills. So when it comes from your insurance, they say, hey, look, you had a patient who went and seen you the other day and they did not have a good experience, and it counts towards us. It could mean deduction in funds at time. It could mean, hey, the insurance probably doesn't want to continue to do business with you. Your insurance is your advocate, and just as much as we can be. But at the end of the day, we ensure that every patient is treated equally and rightfully to the way that they should and any human being would want to be treated. So it matters to ensure that we're giving great and quality care. We ensure that we send every patient a survey link, and they have the right to go ahead and let us know where we went right or where we went wrong.
So, what role do regular doctor visits play in preventive care?
Well, going to see your doctor regularly allows you to pretty much be in a position of having that knowledge. So your doctor, sounds funny enough, but probably knows you a little bit better than you know yourself. We're only familiar with our moms knowing us that much, right? Maybe pops know us better than we know ourselves. But your doctor's another one you need to add on that list, right? They are Santa. They are watching you when you are, asleep. They're looking at those habits. They're aware of probably what you're doing too much of, too little of. So to understand that our doctors know enough information about us just by looking at our care charts, going to see that doctor regularly, they know how to guide you to doing the right things, to what to avoid, what to continue, maybe integrating some fitness in there, maybe integrating some food in there. It's all part of preventative care. Preventative care is literally, it's all in the name. What can I do to ensure I prevent myself from, having cancer eventually? Maybe I have a tumor somewhere. Maybe I am potentially, going blind. Things happen, and we're not always aware of them. Sure, it's our body, but we're not examining our body in the way that a doctor knows how to examine us. These are professionals who went to school and just know how to look for these clues of, hey, something's happening here, and you really need to pay attention. That is preventative care. So get you a primary care doctor, go get seen about, and let them help you prevent anything that could come your way. I think we froze up a little bit. Charles, I think we froze up just a wee bit. Let's see here. All right. No worries. But if I can share with the audience anything, one thing I do want you all to be aware of is that if there's anything stopping you guys from seeing a primary care provider, feel free to call. Just call up and set up that appointment. And we have advocates, not just at Atrium, but at any care facility. You have the ability to talk to someone for free and talk to them about why would it be beneficial to you to go ahead and get that care done. So it's essential that you know what's going on with your body, and it's imperative that you know how to improve the track that you're probably heading towards. Most of us are in actually pretty okay shape, and so you just probably want to know what you're doing right, and hear how you can continue going that route, and probably what you need to avoid to not ruin that winning streak. So that's one thing I would like to kind of share with the audience. I did have a few questions, not questions, but kind of some hints written down. But if we want to talk about things such as the role of trusting healthcare providers, as we've already mentioned, but how that can increase trust in our communities. When I push that out there, to me, having trust in your provider, in anybody within your care team, it doesn't have to be your doctor. Maybe you walk in and you go into a clinic and you see the front desk lady. She doesn't have maybe the best attitude. And so you're like, I don't want to talk to the receptionist and have a bad experience. However, that becomes a part of that trust barrier that a lot of us do experience. That sometimes the customer service is not what it should be. I want to still advocate and let you know that you should go and get seen about. Make sure that you do go and take care of yourself, and let someone know that your experience wasn't what it was, what it should have been. A lot of times we have to realize that we have the ability to fill out those patient surveys, and they work. There's no better way to advocate for yourself than to get out there and push out what that service was like for you. So transformative care, it starts with you taking care of yourself. We can't talk about how to improve healthcare if we're not involved in the healthcare process. Okay, we can't wait until it's too late, and we have to ensure that, for one, we are letting not only community members in our community know why it's imperative to go and get seen about, but we also have to ensure that we are communicating with our care team, no matter who they are, whether it's your clinician, whether it's the woman or the male at the front desk. It could be anybody, but we want to let them know what that experience was. And that is how you pretty much build that trust. You have to continue to just communicate. You are your advocate. And we just ask that you allow us to advocate with you and for you when it comes to taking care of your health. Let's see, that was Ross Charles. Okay. But I see we're still going live here. Let's see here. Okay. So if we can, I want to talk about the importance of annual checkups. Even when you do feel like everything is okay, it's kind of all in there, right? You feel fine, but see, feeling can be one thing, but the reality can be another. Ensure that you are going and you are seeing about yourself, because anything could be the matter. You could, cancerous cells always, you can have them and not feel like you are sick. Sometimes it's all about going to go see about yourself before it gets too late. I don't think that was put out there in reference to, hey, here's a scare tactic, right? It can all be scary. Healthcare is health care. You just got to remember the point of you going to go be seen on an annual basis for sure. Get those wellness visits in. Is to ensure that you're taking care of yourself and that you're in good hands and that you are in the know. You need to know what's going on with your health. You need to know how to improve it. I did want to talk on another topic about going to the emergency room versus going to your primary care, and why I would not advocate for you to go to the ER over a cold. Sometimes a lot of people, we go to the ER when it's too late for us to make it to that primary care giver's office, right? If it can't wait, that's what the ER is for. However, sometimes we can be a little dramatic, and I think a lot of times we tend to go to the emergency room for basic issues, and what it does do is it kind of jacks up the process that healthcare has laid out for us, right? The emergency room is for that urgent need of care. It's for those who are maybe going through a shock, any kind of trauma care. We don't want to slow up the care process that could be tendered for those individuals, or put you in a situation where you're waiting for exceedingly long time, just based off the cause that, hey, they don't have the time to kind of give to your care